Dear viewers, welcome back to my session. We are in the final stages of the series in arterial surgery. This will be followed by other general clinical topics in surgery such as gallstones, hernias, appendix. But in this session, I would like to add a few things because we have already discussed the first topic was mechanism of injury in vascular trauma. The second was arteries in the neck. Then we came to the upper limb arteries. Then we talked about the abdominal trauma and the arteries in the abdomen. And now we are going to talk about two things. That is, we'll talk about the arteries that supply the brain and the spinal cord, and then the arteries of the lower limb, which will conclude our session of arteries in the body. So we continue with the circulation of the body. The circulation of the body, if we talk about the brain right now, then the arteries that supply the brain are first branch, which comes out from the subclavian artery, that is the vertebral artery, ascends into the neck and then into the skull through the foramen magnum on either side, and then it joins to form the basilar artery. But before that, it gives off the posterior inferior cerebellar artery, then it gives off the anterior spinal arteries and the posterior spinal arteries and a few meningeal branches. So these anterior and posterior spinal arteries are the ones which supply the spinal cord above. We know that the internal carotid artery at the level of the fourth cervical vertebrae, it then ascends inside through the carotid canal and of the temporal part of the brain, and then forms the anterior cerebral and the middle cerebral artery. So all these together form the circular villus at inside the skull and all these arteries communicate with each other, and this is how the blood supply to the brain goes. Then in the spinal cord, these anterior and two posterior spinal arteries, they are sufficient up to the cervical level, but below that they need some reinforcements because in the form of supportive arteries like the segmental medullary arteries and the radicular arteries. So one of them is a very important artery which we can talk about, which is called the artery of Adamkiewicz. Artery of Adamkiewicz around the T8 to T12 region, usually it originates from there, but it can, in 15% of the cases, can be a little higher also. And this is normally 0.6 millimeter to 1 meter in diameter, this artery, but this is a important artery because wherever it ascends, it goes through the intravertebral foramen of N, and then it ascends about 2 vertebrae upwards, and then it forms and joins the anterior spinal artery. So this reinforced supportive artery which we are talking about becomes very important in case of surgical procedures, because if this is injured, then the entire spinal cord can be affected and may lead to like ischemia and this even paraplegia and loss of functions, involuntary functions there. But the sensory, though all this is there, but the sensation is still preserved in this case. So this artery becomes important, and it's how the arterial supply of the spinal cord basically happens. Right from top to the up to the conus medullaris. So now we can stop here, and then later we'll move to the arteries of the lower. About the external iliac artery, the surface anatomy of which is 1 finger breadth below and left of the umbilicus up to the mid-inguinal point, which is the point between the anterior superior iliac spine and the pubic symphysis. So lower 2/3 of this. There, then it gives out branches like the deep circumflex iliac artery and the inferior epigastric artery, and then it moves down and to the femoral canal. Femoral canal, it's covered by a sheath that is a part of the external extraperitoneal fascia up to 2.5 centimeters, and then the structures within this femoral triangle, also called as the Scarpa's triangle. This are the vein, artery and nerve medial to laterally with lymphatics medially totally. And then we have the relations that are like medially you have the adductor longus and laterally you have the sartorius muscle which is coming below. So it descends into the subsartorial canal, also called as the Hunter's canal, and it comes out through the hiatus in the adductor magnus to form the popliteal artery. So this is the course of the femoral artery, and it is important because here is where all the catheterization procedures are performed, all the Scheldenker's techniques, and for your angiographies, they are all done with this artery, which is the femoral artery. And also it has a branch which is called a profunda femoral artery that goes below it, deep femoral artery. And then what we need to talk about now is the popliteal artery. And popliteal artery has two segments, which is one of them is present in the femoral region, that is the lower femur region, and the other is in the tibial region below the knee. Now this is a deep artery, and but you can feel the pulsations if you can try, because there are 2-3 places where you can feel the pulsation in the lower limb. One of them is femoral, popliteal, and then you have the dorsalis pedis artery. So I'll talk about the popliteal artery. Popliteal artery then divides into your anterior tibial artery, which then at the level of the ankle forms the dorsalis pedis artery, and while the posterior tibial artery, which is the most important part of the supplies most of the leg, posterior tibial, this and the peroneal arteries also there which supply the leg. So basically it is the femoral artery, the popliteal artery, anterior and posterior tibial arteries, peroneal arteries, and the dorsalis pedis artery, which you can palpate at the tendon of the extensor hallucis longus at the dorsum of the foot. So these are the points where you can palpate femoral, popliteal, and the dorsalis pedis arteries. To find out, suppose there is a block in the femoral artery or there is injury above, you will not feel the pulsations of the dorsalis pedis artery. It is a very simple procedure. So whenever clinically you can just put your two fingers over the index and the middle finger over the extensor hallucis longus tendon, and medial to that, if you can feel the pulse, that means that all pulsations or the vasculature above is intact. In case of injuries or any other, like you want to know whether there is any Burgess disease or thrombogitis obliterans or other peripheral vascular diseases are there, which are compromising the blood flow to the lower limb. So now we've talked about most of the arteries, and I can show you some illustrations which are there which might be helpful to you. These illustrations are of the lower limb. Let's go there and we'll have a look at them. This is the first illustration. Here we see the common iliac arteries and veins, which are dividing into the external iliac artery and vein, internal iliac artery and vein. Internal iliacs you have the obturator, artery, nerve and vein, and the external iliac you have the inferior epigastric artery. Here is the ureter which crosses here. Here is the vas deferens. In the next slide we will talk about we know that the external iliac artery is originating from medial to the psoas muscle and going up to the mid-inguinal point. So this is the cross section here, external iliac artery and vein, that is in relation to the ureter, and this is the umbilical artery, the obturator nerve, artery and vein, the schirectal fossa, levator ani muscle, and this is the retropubic space. This is the external oblique, the peritoneum, this is the conjoint tendon, vas deferens, external iliac artery and vein, and then you have the genitofemoral nerve which is present, and this is the femoral nerve. This is the inferior epigastric artery and vein. This is the inguinal ligament, external iliac artery, external iliac vein, and the obturator artery. This is below the inguinal ligament. This is another diagram which is showing the femoral arteries and the veins. So you have this is the nerve, this is the vein, artery, you have the fascia lata, and you have the lymphatics on the medial side. This is the femoral sheath. This is the segmental breakup of the femoral artery. So you have another diagram showing the adductor longus muscle and the sartorius muscle, and you have the vein, artery and nerve here. This is the lymphatic muscle. This is the vastus medialis muscle, this is the saphenous nerve, this is the femoral artery, and this is the adductor magnus muscle. Then you have the branches, you have the femoral artery, profunda femoral artery, which is, then you have medial femoral circumflex, lateral femoral circumflex. Then you have the descending branch of the lateral femoral circumflex artery, the perforating arteries of the profunda femoral artery. This is the main femoral artery which is coming below, the adductor hiatus is here. Here it becomes the popliteal artery. Then you have the descending genicular artery, medial superior genicular artery, then saphenous branch, medial inferior genicular artery, posterior tibial artery, anterior tibial artery, and the lateral superior genicular artery and the lateral inferior genicular artery. So these forms the circulation around the knee joint. Another diagram which can show you that this is the popliteal artery now. From the popliteal artery you are getting a anterior tibial branch, then the posterior tibial and the peroneal branches. So these are all forming the, you have a network of arteries here, leading branch, lateral malleolar artery, lateral plantar artery, medial plantar artery, medial malleolar artery, the deep plantar arch is there, and the perforating arteries with the digital arteries finally coming in. So we have come to the end of the arteries of the body, and we have talked about most of them. But obviously, I would like to add a few points here. Firstly, this is a very brief introduction to the arteries, because it is just to make you aware where the arteries are in the human body. Then each of these arteries have to be approached in a different manner. So that is a very wide topic, obviously. And now with the advent of many AI generated images, and in our world of internet, I'm sure what I can suggest to you all of you is that the best way to study them would be to hunt around in the internet for any 3D images and models of each of these arteries in relation to the bones, muscles, anterior, posterior, superior, inferior relationships. And I'm sure with the advent of technology, we will be able to understand each of these arteries and the anatomy of the human body very easily. So obviously we have to move on with time, and I'm sure you've had a good experience with me trying to learn about the arteries of the human body. I wish you all the best. Thank you so much.